to Biology Made Easy. In this lesson, we are looking at pulse that happens during heartbeat. Well, what is heartbeat? Quickly, under the influence of sinoatrial node, the whole heart relaxes, and that is diastole. When the heart relaxes, blood fills the atria. Blood from the pulmonary veins fills the left atrium. Blood from the vena cava fills the right atrium. And some of the blood trickles into the ventricle. That is diastole. Then electrical waves from the sinoatrial node flows through the atria, causing the atria to contract, and that is atrial systole. Remember, as the atria contracts, the aortic valve and the pulmonary valve, they are all closed. So blood flows from the atria into the ventricles. Then the ventricles contract, the atrioventricular valves close, the pulmonary valve and the aortic valve, they open and blood flows out through the aorta and also through the pulmonary artery out. So that is heartbeat. But what is pulse? When the ventricles contract, blood flows through the aorta out to all parts of the body. This is the aorta that I've drawn showing at ventricular systole. The aorta stretches, expands so that the blood will flow out. Then moments after ventricular systole, as the aorta stretches, the heart muscle relaxes, and just before it relaxes, these aortic valves, that is here, they close so that the blood will not flow back. So as the aortic valves close, the aorta recoils from a stretched position. So the aorta is stretched bigger, then it recoils, becoming smaller, and as it does that, when it stretches, the blood is pushed out. As it recoils, it pushes the blood further on, creating a surge or a pulse. So that is a pulse. The pulse is simply a pulsation flow of blood. Stretch, recoil, pushing blood, causing a surge. So this surge flows through all the artery and arterioles, and that is a pulse. Pulsation flow of blood, and the pulsation flow of blood through the arteries and the arterioles due to the stretching of the aorta to take in blood and quickly recoiling to prevent a backflow, causing a squeeze or a push and a surge. That is pulse. So you see that the pulse happen at ventricular systole, and that shows one heartbeat. So it's like the heart relaxes, atria contracts, ventricle contracts, pushes the blood, and the push on as it recoils pushes the blood. So that is one heartbeat. One pulse represents one heartbeat. Pulse rate is 60 to 100 beats per minute, just like heartbeat in an adult human. So as we said, as the ventricles contract, aorta stretches and then squeezes, so it sort of pushes the blood on, showing heartbeat. Now, this kind of pulsation flow of blood occurs in all arteries and arterioles, but where they are filled, where they can easily be felt, that is on the surface of the skin. That is why it's peripheral pulse points that we can feel it on the surface of our skin. We've lined up the pulse areas where they can be felt. Now, we will start from up the body. So temporal pulse is at the back of the ear. Carotid is the neck where the windpipe is. Apical is the apex of the heart. The apex of the heart, if it is the heart, this is the apex of the heart, and you know the heart lies in the thoracic cavity, so there are ribs, and in between the ribs are intercostal muscles here, intercostal muscles in between the ribs, and these apical pulse are felt in between the ribs near where the apex of the heart is here. The apex of the heart is here. So as you can see in infants, you have it on the fourth intercostal space at the left. In adults, in the fifth intercostal space. So when you visit the clinics or the hospital and the pulse is being felt at this part of your body, that is the apical pulse. Then brachial pulse is located in the arm, and this brachial pulse is the same as the systolic pressure of the heart. That is the brachial pulse, felt inside the elbow. Femoral pulse is felt in the groin, popliteal behind the knee, posterior tibial at the side of the ankle where the tibial bone is, dorsalis on the foot. And you see where all these peripheral pulse are, they are near bones or lie slightly on bones. That is why they can be felt easily. Inside our bodies, pulse go on all areas where there are arteries, but we can feel them when the arteries are close to the surface of the skin. That is peripheral pulse points. We have two quick questions. Can pulse be felt in the veins? Yes or no? No, pulse cannot be felt in the veins. Why? Well, if you give a reason, it's because before blood enters into the veins, they've passed through capillary beds and the pressure has reduced so much. If you've forgotten about capillary beds, check our lesson on capillary beds. The second question is, you know how pulse is checked with these two fingers, the index and the middle finger, lightly on the area where you can feel the pulse, and you can feel the pulse, boom. Why do we use these two fingers and not the thumb? Well, you gave an answer. It's because at the thumb, the pulse can also be felt at the thumb. So we ignore using the thumb, but these two fingers lightly on the peripheral pulse points. Well, if this lesson has been useful, please give us your likes. Kindly subscribe. Thank you very much. Goodbye.